Hello, everyone. It's the 4th of February. I'm here at my office in New York City. I want to thank you for joining me. Uh, it's a little bit warmer today, so that's good news. Today, I am going to share with you an interview I recorded yesterday with Ed Richardson with Richardson Electronics, an icon in our industry and a fun guy to spend time with. And he's going to talk a little bit about the future as he sees it. But before we go to our interview with Ed, let's take a look at some of the stories that have occurred in our news today. Here is a very interesting story about low dose CT and how it could help with the lung cancer survival rate by 2025. Uh, this is uh, an interesting story. It's good for health. It's also good, I guess, for the CT manufacturers. Also, you see that Eckert and Ziegler is going to open a new radiopharmaceutical development facility in the US. You know, Eckert and Ziegler is a first-class company and uh, based in Germany, I believe, and I'm sure they'll do good work with this. And we need to focus on molecular imaging. Speaking about focusing on molecular imaging, remember that you can sign up for our news for free. If you're only interested in molecular imaging, you only have to receive news as it relates to molecular imaging. And on the other hand, you can receive one of our other silos. So it's great service that we offer, and I encourage you to join us. Hello, everyone. And as promised, I'm joined today by Ed Richardson, who's the CEO, the chairman and CEO of Richardson Electronics. Ed, thanks for joining us.
Hi, Phil. Nice to be here.
And for those of you who know Ed, you know that he's the second generation there. Is that correct, Ed?
That's right. I've been around so long, it's hard to believe I'm second generation, but
Now, full disclosure, ladies and gentlemen, the Jacobus family are own stock in Richardson Electronics because we visited the company and we were impressed. So we bought stock, just FYI.
thank you very much. It's a great investment.
So Ed, um, a few years ago, you started to manufacture, you made the commitment to build a line to produce CT tubes for use in what was then the Toshiba CT scanner. How's that going?
Well, it's going very well. In the quarter we just finished, we had the highest sales number for those CT tubes in our history, and so we're happy about that.
Right. And along the line, you also purchased IMES down in, I think, Charlotte, if I'm not mistaken, right?
Yes, that's correct. Our strategy was to be able to supply all the replacement parts in the Toshiba CT scanners along with the tubes. And we also teach technicians on how to install the tubes in the CT scanners and how to service the CT scanners.
Yes, I visited that facility at one point. How's that training going?
It's doing well. We were set back a little bit because of COVID, but right now it's turned around and we're doing a lot of training.
And is any of that training remote training?
Yes, we do some remote training as well.
Now, in visiting the factory, I know that for a long time, one of the things that Richardson did was manufacture radio tubes, right? Is that what they're called, radio tubes? And
Oh, yes, we would say power grid tubes now. And radio tubes are pretty much a thing of the past, but we still sell a few.
right, and that I guess we call that a legacy business. How's that going?
Well, it's the most profitable business we have. I would say we still do about $100 million a year in the tube business. So it's a small industry. I wish there were more like it, but it's still there and primarily aftermarket, selling replacement tubes for existing equipment.
I see. And over time, that equipment will probably be phased out, I assume.
Well, they told me that 25 years ago, to specialize in the tube business, you're crazy. It'll be gone in 5 years, but here it is, and it's still going.
Here we are. Now, what plans for the future do you have?
Well, we've gone in a number of directions. A number of years ago, we were in the RF and microwave semiconductor business, and we sold that business, but the customers stayed after us and wanted to have us supply those products. So about 6 years ago now, we started back in that business, and that's a really high growth area for us. It's growing rather rapidly right now because of 5G.
And so you're manufacturing some product that's used in 5G technology?
Yes, we both manufacture products that go into semiconductor wafer fab equipment, and we also distribute for all the majors like Qorvo and MACOM and Fuji, people like that.
Right. So that has to be really a growth business because 5G is all you hear about now.
That's true. Right now, the fastest growing area of our business is supplying equipment that goes into semiconductor wafer fabrication.
Now, I think you mentioned to me, and normally we are able to get together over RSNA, but this past year there was no RSNA, so there was no get together.
Right.
I think you mentioned, however, that Richardson is looking into manufacturing a new type of tube. Is that right?
That's true.
For CT.
Right. One tube doesn't make a tube manufacturer for sure. And we've spent, about $28 million so far on equipment and R&D on CT tubes. And as you know, there are four major manufacturers in the CT business. So you have Siemens and GE, Philips, and Toshiba. And our ultimate objective is to be able to supply replacement tubes for a number of those manufacturers. And we've been working on that. And I think within the next 12 months, we'll be releasing tubes to replace CT tubes and the other equipment besides Toshiba.
Now, how do you overcome, is there software used in CT tubes that is proprietary or not? I really don't know, to be honest with you.
Yeah, there is. Particularly Siemens equipment has a great deal of software around it, and so those are things we have to learn as we go along, for sure.
Now, it took you a long time, or a relatively long time. How long did it take to build the assembly line to produce what was then Toshiba and we'll now start calling Canon for the remainder of this discussion? How long did it take you to put together that line?
The better part of 5 years.
Right. And do you think it will take you less time to produce new tubes now, since you've sort of done it?
Right. I mean, it's all built on the same equipment. We do have to add new scanners to be able to test the equipment and rooms to do that, and we already have added those rooms. But for the most part, the equipment that's necessary to build the tubes we have in place, and got a great engineering staff, and so they're up and running, and we think these new tubes we'll have out within the next 12 months.
So am I correct that the special assembly line that I visited with the special room and the reverse air pressure and all that can be reused in making a different tube, or you don't have to build a whole nother assembly line? Is that correct?
No. The jigs, dies, tooling, and fixtures are different, but and the test equipment is different. You've got to have, CT scanners from those manufacturers, but all the assembly equipment, the bake out equipment, the processing equipment is all pretty much the same.
Okay. So there's a lot of talk in the market about independent service, non-OEM service, both in-house and independent service companies. What do you think about the future of independent service? Will that be constrained, or will the government support in-house, or will the government be hands-off?
We think it's absolutely essential to the future of the healthcare industry. The OEMs, they make more money selling replacement parts than they do selling new equipment, in my opinion. And we want to supply parts and tubes on a cost-effective basis to be able to offer, much lower prices to the medical institutions and reduce healthcare costs.
Right. Well, that's a tall order. What about the economy in general? Do you think that what do you, when you look into your crystal ball, what do you see happening in 2021?
Well, I think it's going to continue to improve. We saw in 2020, like everyone, that the COVID, had a major impact. It was sort of a two-edged sword. Medical institutions, hospitals were not buying new capital equipment under the economic conditions that were happening, but at the same time, they were repairing existing equipment. So that increased the aftermarket for us and the need for training and service and that type of thing. I don't know. I think the hospitals have all lost a lot of money. I think it'll be a long time before they start spending a lot of money on capital equipment again. I think they'll keep the equipment they have and repair it, which is good news for us short term, for sure.
Right. Well, very interesting. I'm optimistic about the future, so I hope that my optimism and your optimism are not mutually exclusive.
Well, I think everyone just wants to get, have a year when we get behind or get this COVID thing out of the way. Everyone gets vaccinated and we get back to normal life. I don't think it'll ever be the same. We've learned that we don't have to travel all over the world to sell product. We're selling lots of product without going to China 4 times a year and those kinds of things.
What do you think about trade shows in the future? That's a very interesting question for us right now. What do you think about the future of trade shows?
Well, we've already taken a position where we probably won't exhibit at the trade shows. We'll be there. We'll probably have suites where we can meet with people and to talk to people. We'll do virtual tours of our facilities as we have now, but we're certainly not going to spend the kind of money that we did in the past, several $100,000 to go to the RSNA or something like that.
I mean, if everybody thinks like you, it won't do you any good to have a suite at the hotel because no one will go.
That's true.
I'm afraid to go to shows for fear that I'll get sick.
Yeah. No,
and especially in 2021, I'm afraid. But I think it'll probably be years before things get back to normal. The airlines think it's going to be 2 or 3 years.
Yeah, no, I agree. If it ever gets back to normal, yeah. There's a new normal. That's what's going to happen.
Yes, that's a very good way of putting it.
Yeah.
Well, thanks very much for spending time. It occurs to me that you and I or that you and Ed Sloan and myself should probably do an interview at some point to talk about the future.
That would be fun.
I'm not in your league or Ed's league, but there you go.
Oh, you certainly are. Ed's the grandfather to all of us,
Yes.
He's helped us a lot over the years. He really has.
Yeah.
He's a special man.
Well, Mr. Richardson, thank you very much for joining me today. It's always a pleasure to speak to you. I'm glad things are going well for you. And congratulations.
Thanks, Phil. Thanks for having us.